Our last feature we're going to cover on the scapula is the suprascapular notch. We break that word down. Suprascapular is meaning above the scapula, and a notch is just a notch or an indention in the bone. Where you're going to find the suprascapular notch is between the superior border and the coracoid process. So you see this indention in the bone, and that is the suprascapular notch, and you can see it from the back view and also from the front right here. Moving on to the clavicle, this is the anatomically correct way to say the collarbone. It will have two ends, the sternal end, which will be more round, and it's found on the medial side of the bone as it comes into contact with the sternum, whereas the acromial end is going to be flatter and more broad, and this is going to be found on the lateral side, and it's going to be coming into contact with the acromion of the scapula. The conoid tubercle, if you'll recall, tubercle means small, rounded bump. Conoid means in the shape of a cone, and this will be found on the posterior inferior side of the bone. So as we take a look, if you look at both ends, you'll notice that they look a little bit different. This end is going to be much more round, so that will be the sternal end, and that will be located on the medial side of the bone. On the opposite side, we see this flat side, which will be the acromial end, and that's going to be coming into contact with the acromion, so that will be found on the lateral side. Now, something you also should note is this superior view is going to be what we're looking at the top. If you'll take a look here, it's much more smooth compared to the inferior side. And here, there's lots of bumps all over this. Now, on the inferior side, you'll notice this cone-shaped bump right there. That is called the conoid tubercle. And something you also want to note is it's found closer to the lateral side or the acromial end here. Moving on to the humerus is going to be the bone found in the upper arm in the brachial region. And there are quite a few features we're going to go over on this bone. The first one is the head. This is going to be the rounded portion found on the medial side. So you can take note that the head is found on the medial side of the bone. That'll help you figure out right from left. Just like we saw with the femur, the head is going to come into contact and fit in that glenoid fossa or glenoid cavity of the scapula, and it's going to form that ball and socket joint as your arm can freely rotate around. We're also going to have the anatomical neck, which is our first neck. There will be two necks on the humerus. The anatomical neck is going to be the smaller neck, and it's found just between the head and the rest of the bone, because what it's doing is it's connecting the head to the bone itself. It's called the anatomical neck. We're also going to have two tubercles, a greater and lesser tubercle. The greater tubercle is found on the lateral side, so it'll be opposite to the head, and it's going to be the bigger tubercle. Also with the greater tubercle, you can see it from an anterior and posterior view of the humerus. The lesser tubercle will be smaller, and it's only seen on the anterior side. So if you can see the lesser tubercle, you know you're looking at the front of the bone, and again, that will help you figure out right from left. We also have a structure called the intertubercular groove or sulcus. So this is a groove that's going to be running between the lesser and greater tubercle on the anterior side. And so when we talk about muscles later on, the biceps brachii long head, the tendon for it, is going to slide through this groove. The surgical neck is going to be connecting most of the structures we just talked about. So both the tubercles, the head, the anatomical neck, to the shaft of the bone. It's called the surgical neck, and it gets its name because the humerus, a lot of times, this is where it's broken. The shaft is just going to be the long, slender middle portion. And then we're also going to have something called the deltoid tuberosity. Now, one thing you want to note about the deltoid tuberosity is it's located on the lateral side of the bone. And it's just going to be a small little ridge, kind of a rough projection on the shaft, on the lateral side of the shaft. And this is going to be where your deltoid muscle is going to insert. We're also going to have the trochlea. Get this name because it's pulley shaped. This is going to be where one of your antebrachial bones, called the ulna, is going to articulate and be able to slide back and forth. It's on a structure called the trochlea, and we'll see what that looks like here in just a moment.